And our local lawmakers are reacting to the bill's passing. Missouri Congressman Mark Alford calling today a watershed moment. And Kansas City's Emmanuel Cleaver mocking the bill's name, calling it the big ugly bill and filled with lofty goals that will go unfulfilled. Regardless, there will be ripple effects once President Trump signs this bill.
Yeah, hospitals in our area are already bracing for massive cuts to Medicare and Medicaid. KCTV5's Ryan Hennessy reports from University Health.
The eligibility requirements for government programs like Medicare and Medicaid will tighten for those living on a limited income. For here in Kansas City, many of those patients will turn to University Health.
We are extremely experienced at helping our patients that are on Medicaid. Almost 50% of our patients are in the Medicaid system right now.
That experience will be tested. To keep their coverage, patients will need to provide proof of employment and file income documents every 6 months instead of once a year.
I think the biggest message that we tell our patients is, we're going to be with you every step of the way on this. And we're not going to wait 18 months and then all of a sudden this happens. We're going to make sure that you're ready when it happens.
The 18th month deadline is when the new work requirement takes effect, requiring people under age 64 to prove they work at least 80 hours a month. And it's not just hospitals feeling the squeeze. Across state line in Johnson County, a potential for ambulance services to feel financial pressure as well.
So we know we're seeing more call volume. A significant portion is reimbursed through Medicaid and Medicare. With cuts to Medicaid, we are going to see additional costs that we'll have to undertake as Johnson County to maintain the level of service that we have for our community.
The Kansas Hospital Association reports 360,000 people receive Medicaid in Kansas.
This includes 1/3 of all births in Kansas are covered by Medicaid, and 2/3 of all nursing home residents have Medicaid coverage.
And that's why hospitals, patients, and providers want to get ahead of these changes. With Medicaid impacting everything from birth to long-term care, the goal is to keep coverage strong while the rules shift. In downtown, Ryan Hennessy, KCTV5.